Hey everyone, Dr. Seth Yellin from Marietta Facial Plastic Surgery, Laser and Aesthetic Center. We're making this video today to hopefully inform you when you come in for your preoperative visit and answer a lot of questions that seem to be recurring. These are very common, and I encourage you to watch this video before your preoperative visit, whether you're having an in-office procedure or one at the main surgical center at Marietta Surgery Center. This is a mock interview. With me today is Desiree Hatton. You'll be seeing her when you're in the office. She is our surgical tech, and she's the one who really conducts most of the preoperative visits. So we're going to walk through the instruction sheet that she goes over with you, and I'll sort of fill in some of the details to give you some insight into what we're expecting of you getting ready for your procedure. So with that, hey Desiree, thanks for joining us today.
Hey.
So what I'd like to do is just walk through the preoperative instructions, and I want you to pretend like you're a patient, you do these preoperative visits all the time, and just sort of share with us the questions that you get repeatedly, and I'll try to answer them.
Okay. So my first question is, why can't I take my supplements and my vitamins?
Good question. So many vitamins are very helpful in healing. The most common, well-described one is vitamin C. And in your instructions, you'll see that we encourage you to take vitamin C. It helps with collagen cross-linking and skin healing. However, many supplements, ginkgo biloba, ginger, ginseng, in supplement form, and many others, are known to increase your risk of bleeding. So since many supplements are not studied and are not regulated by the FDA, and supplements are important, if they are at all, for long-term health and have no negative impact if you stop them short-term, we want you to be safe. We don't want you to have excessive bleeding or bruising, and it's just very, very simple to make a blanket statement. No supplements except for vitamin C during your post-operative experience and getting ready for surgery. So you'll stop those for 2 weeks before and 2 weeks after, and that way we'll eliminate that risk.
Next question, what are the benefits of taking homeopathic arnica and bromelain?
So the key there is homeopathic bromelain and arnica. Those two products are intended to reduce the amount of bruising that you'll experience after whether it be a surgery in the office or in the main OR, or even injectables.
Right.
So it's to reduce bruising. And again, they're elective, you don't have to take them, but they've been studied and they've been shown to really help.
Okay. I need a glass of wine every night. Why can't I drink my wine?
Well, again, it's about your safety, right? So these are elective procedures, and we want to stack the deck in the patient's favor. We really don't want you to have undue risks, and alcohol thins your blood. Alcohol makes you bleed, and I appreciate the desire for patients to have a relaxing glass of wine at the end of the day, but in the 2 weeks leading up to surgery and the 2 weeks after, hold off on all alcohol consumption.
Good. Also, I have arthritis and I take ibuprofen all the time. Why can't I take that?
So there are many over-the-counter pain relievers. The only one that is safe in the pre and post-operative period after surgery is acetaminophen, also known as Tylenol. All of the ibuprofens are called non-steroidal anti-inflammatory drugs, and they are used for inflammation. So arthritis is an inflammatory disease, but they inactivate platelets. And I include aspirin as the #1 offender. Aspirin in particular permanently inactivates platelets, and it takes 8 days to regrow a normal platelet count. So again, abundance of safety, stop all ibuprofen and aspirin products, as well as things like naproxen and other anti-inflammatories for 2 weeks before and 2 weeks after, and that way will reduce your risk of post-operative bleeding, which could be serious in some cases.
Another question, is this procedure where I need to stop eating at midnight? Is this procedure a procedure where I need to stop eating at midnight?
So one of the advantages of doing in-office procedures is avoiding general anesthesia. And the reason to not eat is really, it's during the intubation of the patient, when you put a breathing tube in, that they're worried about regurgitation of stomach contents up and into the airway. So we don't intubate in the office. In fact, we use oral Xanax to relax you, but you're able to eat normally. In fact, we encourage you, if you're having a morning procedure, to have breakfast, or in the afternoon, have lunch. And that way you'll feel better, your blood sugar will be more adequate. And in fact, it's one of the real advantages. You don't have to get all anxious about not eating and not having your morning cup of coffee. But if you are going to sleep in the main operating room for a procedure, then the rule is nothing to eat or drink after midnight. If you need to take some pills in the morning, like blood pressure pills and so on, with a sip of water, totally safe. But you certainly don't want to have any food or drink in your system of any great volume.
Okay, and that's in the main operating room, that
Yep.
last part.
That main operating room.
Someone once said to me, I have false eyelashes and I just got them put on. Why do I have to take them off?
So the only time you have to take off false eyelashes is if we're working around the eyes. So if we're doing an eyelid surgery, cosmetic blepharoplasty or cosmetic improvement of the eyelids, you have to take them off because we're prepping that area and they interfere with my ability to do the procedure. But if we're not working around the eyes, it's perfectly safe to leave them on.
Okay. Makeup. I have this question quite often. I don't look good without makeup. You mean I have to come in without makeup on, even mascara?
Yes.
For my procedure?
Yes. So makeup is just a contaminant from my perspective. And the key is to create a sterile, safe, operative environment. So all makeup, all facial creams, everything are to be left off the day of the procedure. You come into the operating room, whether it be in the office, main OR, nothing on your face. Clean face, ladies, clean face.
What about rings, earrings? I have multiple patients say, I haven't taken my wedding ring off in years and you really want me to take my wedding ring off, or earrings,
Yeah.
piercings.
Yeah. So piercings and jewelry are conductors. They're made of metals, and we use electric cautery. There are grounding pads that are placed under your hip or on your skin in the main operating room, and your body is literally conducting electricity. The energy is going to the wound to stop bleeding, going through you, through the grounding pad and back to the machine. If you have any kind of metal jewelry on you or any kind of piercings, electricity will go to that metal and burn you. So, yeah, don't wear metal. Take out your piercings. Be smart.
Very important. Is the operating room cold?
So the operating room is kept cooler. I wouldn't say it's cold. The main operating room I do keep pretty cold because the lights are very warm. But in this office operating room, we do have some OR lights that do add heat. The equipment runs better when it's a little cooler. So if you're at all concerned about being chilly, just communicate that to us and we'll cover you with a blanket. We'll keep you comfortable.
It's always good to bring your own blanket also, please.
There you go. You can bring your own cozy blanket.
Will I have a scar?
So unless someone is a magician, you cannot cut skin without creating a scar. Right? So cosmetic surgery is always a trade of creating scar for creating the improvement that you're looking to improve, right? Sagging neck, heavy lids. But my job is to place scars in ways that are the least noticed. As an example, a facelift takes advantage of the curves of the ear, so the incision is hidden around the ear, never in front. The eyelid, there's a natural crease, and we hide the lateral corner incision up into a crow's foot. But yeah, if I cut the skin, there's going to be a scar. Now, I work really hard to close my wounds as perfectly as I can, but we don't control healing. We have very little that we can do to modify healing, and whenever possible, we take advantage of those tools, such as topical Silogen, injectable Kenalog, which is a steroid to modify healing. and wound massage. But the answer is absolutely. If you get your skin cut, you're going to have a scar. The key is that the scar is very minimally noticeable and the benefits are maximally noticeable. So that's the key. Great trade.
Will my procedure hurt?
So again, if I do anything surgical, we're going to numb you. We have lots of ways of keeping you comfortable when you're in the office. We have Pronox, which is self-administered nitrous oxide that you can breathe, and that just sort of disassociates you while you're getting the injections for numbing. We also use oral Xanax, usually 2 milligrams for most people, and that really relaxes you. Many people even fall asleep during the procedure from Xanax. But once you're numb with local anesthetic, you're not going to feel anything. And of course, in the operating room at Marietta Surgical Center, we have a full anesthesia team, which, by the way, is an Emory anesthesia team. And these are the same people I worked with when I was full-time Emory for many years. So you'll be asleep and you won't feel anything. So in general, once we get going, you should really feel nothing. Now I will say there are times when we're operating, let's say on an eyelid, even when you're numb, you could feel a little heat of the cautery, but that's quick and momentary, and usually you don't remember it anyway because you've got Xanax on board. So there it is.
All right, last question. How long will bruising and swelling last after a procedure?
So bruising and swelling is personal, right? Darker hair, darker eyed people tend to bruise and swell a little less. Blondes, blue eyes, sort of a little more, and redheads even more. So during healing, you know your own skin, you know your propensity to bruise and bleed. As we get older, our skin thins and we're more likely to bruise as well. So everyone has to know their own bodies, but I'll say in general, bruising tends to dissipate within a week to 2 weeks, as does probably 30 to 40% of the swelling. With any surgical procedure, healing doesn't take days or weeks, it takes months. Soft tissue healing gradually improves over time and usually is sort of complete around a year. Rhinoplasty is the one exception. Final rhinoplasty results are usually about 18 months.
Okay.
Good job.
Thank
Any
you
other
very much.
questions?
Those are the main ones.
All right, so I hope that answers some of the questions that you might have. I look forward to seeing you for your next procedure. If you need us, please reach out during the post-operative period. There's a phone number that is directing you to the patient phone. You can always communicate with us afterwards or even before. You can always send us pictures while you're healing. We're always available 24/7, and we look forward to taking care of you. Bye now.